Most people think that high cholesterol is mainly about genetics or the food on their plate. But in clinical practice, one of the most powerful and consistent ways I see cholesterol improve is through losing excess body fat. Not extreme dieting, not quick fixes, through sustainable fat loss that changes how the body handles cholesterol at a metabolic level. In this video, I'm going to walk you through 5 ways losing body fat directly lowers raised cholesterol. And if you stick around to the end, I'll also explain one bonus reason that I see overlooked all the time in my clinic, which often explains why cholesterol improves even before people think they've done everything right. Number 1, excess body fat, particularly around the abdomen, changes how the liver functions. You see, when fat mass is high, the liver produces more LDL cholesterol. This is the type that contributes to plaque buildup in the arteries. As body fat reduces, this overproduction slows down at the source. The key takeaway here is that cholesterol isn't just a food issue, it's a metabolic issue. Improving body composition reduces harmful cholesterol production upstream, not just on a blood test. Number 2, fat loss is one of the most reliable ways to increase protective HDL cholesterol. HDL helps to remove excess cholesterol from blood vessels and to transport it back to the liver for clearance, acting as a sort of cleanup system for the arteries. I've seen patients make multiple dietary changes with little movement in their HDL levels. Then once they start losing body fat through consistent daily activity, the good cholesterol, the protective HDL cholesterol, that rises without any other major changes. The practical point here is that movement matters. Regular walking and resistance training have a far bigger impact on HDL than supplements or single dietary tweaks. Number 3, when the body is storing excess energy as fat, triglyceride levels tend to rise. You see, high triglycerides act as a strong marker of metabolic strain and are closely linked to cardiovascular risk. As fat mass reduces, the body becomes so much better at clearing triglycerides from the bloodstream. The key takeaway here is that raised triglycerides often reflect long-term energy imbalance rather than one specific bad food. Reducing body fat improves triglycerides even before someone reaches a so-called ideal weight that they might have in mind at the start of their diet. Number 4, excess body fat worsens insulin resistance, and insulin resistance disrupts cholesterol balance. It leads to higher triglycerides and smaller, denser LDL particles that are more likely to penetrate artery walls and cause damage. Losing fat improves insulin sensitivity. This shifts cholesterol towards a safer pattern. In clinic, I often explain that cholesterol improves with fat loss not because it's cosmetic, but because the underlying metabolism becomes so much healthier. The practical focus here should be steady, sustainable fat loss. Crash dieting may lower weight temporarily, but it often worsens insulin resistance and cholesterol patterns long term. Number 5, fat tissue is metabolically active. It releases inflammatory chemicals that damage blood vessel walls, making cholesterol more likely to stick to them and form plaques. As fat reduces, this inflammatory environment settles and arteries become less vulnerable to cholesterol-related damage. The key message here is that cholesterol risk isn't just about the number, it's about how inflamed and how fragile the blood vessels are. And here's the bonus point that I promised earlier on. Losing body fat often improves cholesterol even before diet quality has dramatically changed. I've had patients genuinely surprised that their cholesterol improved while they were still working on their nutrition. That's because reducing fat mass itself changes liver function, insulin sensitivity, and cholesterol handling. This doesn't mean diet doesn't matter, it just means that fat loss is a powerful lever on its own, and often the missing piece when cholesterol doesn't respond as expected. So, the bottom line is this: high cholesterol isn't just a genetics problem or a food problem. Very often, it's a body fat and metabolic health problem. And as excess fat reduces, cholesterol improves in ways medication alone can't often replicate. Dr. Derek here. If you found this helpful, please leave a like and subscribe. And as always, I truly care about your health and I wish you the very best.